Kidneys are actually very important organs. They're responsible for regulating a lot of body processes. Number one, they're responsible for eliminating a lot of waste from normal metabolic processes. As well, they help to regulate fluid balance in your body, as well as electrolyte balance like potassium and calcium and phosphorus, as well as regulating blood pressure and also regulating red blood cell production. Well, having two kidneys is interesting. It's a redundant system. No one knows why it's there. It's kind of like having an appendix. It's there, but we don't know what it does. In any case, you can survive very well on a single kidney because the way that you should look at it is right now with the two kidneys, you're at 100% function. Once you donate a kidney or you lose a kidney for whatever reason, you'll be about 60 to 65% function, but really to be normal, you only need 30% function. We actually don't start considering people for kidney transplantation until they get to 20% or below. So with 60% function, you're perfectly normal. All it means is you don't have as much reserve as you normally would. So there are a couple of things you have to look out for as far as diet and medications afterwards. But other than that, people do very well with a single kidney. Well, generally speaking, if one kidney is failing, the other one is failing unless it's for some mechanical reason. And a lot of the common signs and symptoms include things like fatigue, itching, fluid retention. Sometimes the first thing that people see is they start getting peripheral edema or fluid in their legs, as well as difficulty breathing because they develop congestive heart failure. Those are some of the common things that you see with renal disease. Well, the quality of life once your kidneys fail and you go on dialysis is generally fairly poor. One of the most important things, of course, from a patient standpoint is the lifestyle tends to take a big hit because once you're on dialysis, you're basically tied to going to either hemodialysis 3 times a week, which means several hours 3 times a week where you're basically tied down and you can't do anything. Most people are feeling very wiped out and fatigued afterwards. Even in patients who are on peritoneal dialysis who do it at home, you're still tied down to the machine and you have to do it daily. So there are certain lifestyle limitations that come with it, but more importantly, having kidney disease has an important effect on how long you live. If you're diabetic and you're on dialysis, at 5 years, your chances of dying is almost 40 to 50% compared to someone who actually gets a kidney transplant or someone who does not have kidney disease. So it has a significant impact.